Rhinoplasty is one of the most common procedures we do here at the Aesthetic Center. It is any operation that changes the shape of the nose, and it's classified into cosmetic or purely for appearance versus functional for breathing, and many of these operations combine both in one procedure. The way you change the shape of the nose is to modify the cartilage and bone that is the skeleton of the nose. If you modify that and change the basic shape, the skin will shrink down around that, and that's how you get your final result. In rhinoplasty surgery, where we modify the nose, every patient has unique findings, and the nose is the most diverse anatomy in the human body. Nobody has one like someone else. So each operation has to be designed and performed for that unique situation. So every patient is totally unique. In rhinoplasty surgery, we want to create a natural, aesthetically pleasing nose that looks like it's been there since the patient was born. We don't want it to be obvious that anyone has had nasal surgery. There's a stereotype of rhinoplasty out there from Hollywood, New York, etc., of the ski slope noses, the pinch tips, the upturned nose. We never want to see that kind of thing. We want something that is aesthetically pleasing and will be pleasing for the patient's entire life. Recovery from rhinoplasty surgery generally takes about a week. There may be sutures and splints to take off. There certainly will be some bruising around the eyes. Most of that is either gone in a week or it can be covered with makeup at that time. And I would say the average patient goes back to work or school in 7 to 8 days. There is great interest in the so-called liquid rhinoplasty today, and that's where we use fillers to modify the shape of the nose externally. There are circumstances where that can be quite useful for small depressions or to make things even from one side to another, or even to hide a small hump that's there, and that can be done safely and effectively. It is a temporary solution, however, and in 6 to 12 months you'll be back where you started. So it does have some real good use, but it's not a replacement for a traditional surgical rhinoplasty. Rhinoplasty patients have a very high satisfaction rate with their operations. Many have wanted this for years, and when it's finally done and they see the changes, they're really quite happy with it, and they know that it's going to stay that way for the rest of their lives. It can really help them with self-image. It makes people feel more confident, and often they've got improved nasal airways so they can breathe better, so they can feel better and sleep better. And that makes us feel good because we know we're doing something that really helps the patient.